Go.
Hey everybody, Dr. Somareddy here again. So I'm going over a second part of my professional development series here for YouTube. And I just want to go over a little bit of a clinical aspect of what I've discovered over the past couple of years, my experience, my personal experience in physical therapy. When I first started practicing physical therapy back in 2000, end of 2001, I was very fortunate to run into a number of guys who showed me a technique called strain counter-strain. At the same time, I was taking my transition from DPT at Rocky Mountain University with some of the best physical therapists I've ever been around with, Gail Dial, to name a couple, Mark Brooks, and a couple other guys who really, Ed Ramsey, just come to my mind as we were talking about it, that helped me develop my clinical aspects as well, from an evidence-based practice, and also from just learning what our profession was going through at that time with DPT programs that were coming about, and also using a transitional DPT program to increase my knowledge base of what I was doing from an MPT. But anyway, during this period of time I got introduced to this technique called strain counter-strain, and since then I've been practicing this technique. And strain counter-strain, the literature has and does have some evidence, but it's not as evidenced as some of the other techniques out there. So the point I'm trying to bring up here today is that I've treated a number of patients over the years. I've treated patients with all sorts of conditions, from headaches to dizziness to shoulder pain to thoracic spine pain to pelvic floor pain to some of the strangest things you might have heard out there. And some of the greatest results I've had with these patients, some of the Yahoo moments I've had with these patients, was the use of strain counter-strain and techniques that I basically were like not really sure to use on the patient, but I just kind of felt that it was something that I hadn't treated in an area that I had to go into. And it kind of led me toward discovering a little more about strain counter-strain, some other techniques that I've had to use. And over the time I've become more interested in obviously learning more about it, and my anatomy skills have increased quite a bit, my palpation skills have increased a lot. And my point that I'm trying to go across here is that my decision to discover and not stop learning and not stop pursuing why certain things were happening has ultimately led me to treat patients that come into me with a lot of strange complaints and also help them. So whereas as a newer grad, a patient came in and said, I get a headache and some jaw pain, and at nighttime when I lay down I'd get dizzy turning my head to the right, I'd look at them and say, oh man, I don't know what I can do for this person. What do I do? Where do I start? And now, as I've kind of grown with my research, my own personal research and discovery, those are conditions that I could actually feel comfortable going in there and saying, great, well, let me start working on this, that, and the other thing to try to help these patients out. And that feeling, knowing that I can help this person out, in my opinion, is the best feeling, because I feel like if I can't help that person out, if I don't know what to do, then I have to refer them to somebody else. If that person doesn't know what to do with that patient, then that has to be referred to somebody else. So this patient is not really getting help from me, but certainly not getting help from somebody else who may or may not know how to do that. So learning more and trying to discover more and trying to work through some of these things has been a really, really valuable tool for me in my manual therapy development, but also my development as a practitioner. I feel that I've gotten a lot better. I feel like I've gotten a lot more out of it, and I feel like my patients have gotten a lot more out of it because I'm now able to do different techniques on them that they feel comfortable with. So any manual therapist that you speak to, I think that's pretty good, will run into this sort of situation where they have a patient that they try something different on that they're not sure is going to work, but they're trying to help that patient out because whatever else they've tried hasn't worked or has gotten them about 50% result or 60% of the result, and they do something and they're like, wow, that really helped. So I think that the take-home message here is just to make sure that we continue to try to discover, we continue to treat our patients in a bit of a case study viewpoint, and that you always want to use your own personal research in your clinic, in the room, on the table with that patient to discover what can work best for that patient and for that individual case, and also to utilize some of the research that exists to sort of streamline and efficiently treat the patient, but not forget that some of the best discoveries do occur in a room, closed door, patient on the table, communicating to you, you communicating to them, your hands on them, trying something different, and all of a sudden finding out that you got a good result, and then trying that over a course of a number of different patients to eventually develop your kind of own protocol on how to develop and do things. So again, the take-home message here is to never stop trying to be a discoverer, and discover new things that can help patients, that can give them benefits that maybe somebody else couldn't give them, or they certainly couldn't get on their own, or they may have spent months or years trying to find out why certain things are happening. So we as physical therapists have that responsibility, like any other practitioner, to really try our best to become the best we can be at what we do and discover new things at a consistent basis. So don't get stagnant, don't get stuck in a fixed way. Remember, every single one of your patients that comes in the door, young, old, small, thin, surgery, non-surgery, whatever it may be, they all need help. And they all need help in a way where they can get positive results and get rid of their problem from whatever the problem might be. Hope that helps.